What is a sweat test for cystic fibrosis? Imagine a simple test that can reveal how well your body's salt balance is working. That's what a sweat test for cystic fibrosis is all about. It's a key tool doctors use to diagnose this inherited condition that affects many body systems. Cystic fibrosis impacts the cells lining your lungs, pancreas, and sweat glands. It causes thick, sticky mucus to build up, leading to breathing problems and digestive issues. But how does a sweat test help identify this disorder? The test works by stimulating sweat production on a small patch of skin, usually on the arm or leg. A doctor applies a tiny amount of a safe, colorless chemical called pilocarpine to the skin. Then, a mild electrical current is used to encourage the sweat glands to produce sweat. This process takes about 10 to 15 minutes. The sweat is then collected on special filter paper, gauze, or in a small plastic coil over roughly 30 minutes. The collected sweat is sent to a lab where its chloride level is measured. Chloride is a type of salt, and in people with cystic fibrosis, chloride levels are often 2 to 5 times higher than normal. This abnormal salt transport is caused by mutations in the CFTR gene, which affects how salt and water move in and out of cells. The sweat test is painless and does not involve needles, making it suitable even for infants. It is often recommended for newborns as early as 48 hours after birth if there is a family history of cystic fibrosis or if newborn screening suggests the disease. Sometimes, the test may be repeated if the initial sweat production is insufficient. For older children or adults showing symptoms like persistent cough, lung infections, or digestive problems, the sweat test can confirm whether cystic fibrosis is the cause. Preparing for the test is simple. Patients should avoid applying lotions or creams to the skin 24 hours before the test. Staying well hydrated is important, but there are no restrictions on eating or drinking unless your doctor advises otherwise. The test is usually performed at specialized clinics that are experienced in CF testing to ensure accuracy and safety. From the perspective of cystic fibrosis, the sweat test is vital because it directly measures the abnormal salt transport caused by the defective CFTR protein. Elevated chloride levels in sweat reflected the underlying problem with chloride ion movement, which also impacts how the lungs and digestive system function. Early diagnosis through this test allows for timely treatment, which can significantly improve quality of life and health outcomes. In summary, the sweat test is a safe, non-invasive, and essential diagnostic procedure that helps confirm cystic fibrosis by detecting high chloride levels in sweat. It provides a window into how the disease affects sweat gland function and other parts of the body, guiding healthcare providers in delivering the right care. Always consult with a healthcare professional for personalized advice and diagnosis.